oral hygiene advice when appropriate. There are other tasks in the area of periodontics that the dentist must have mastered prior to implant training. It's essential that the dentist be familiar with techniques for the management of periodontal disease and be able to carry out general periodontal treatment and care for a patient. The dentist must also have knowledge of outcomes of periodontal treatment, be able to monitor a patient's periodontal condition in the short and long term, and be able to provide maintenance therapy. Dentists should have a clear understanding of prosthodontic concepts and adequate skills in the prosthetic replacement of teeth, including a good working knowledge of conventional prostheses. They should be aware of these prostheses as potential treatment options for the replacement of missing teeth, as well as missing hard and soft tissues of the oral cavity. Furthermore, the dentist must have knowledge of the survival and complication rates of conventional fixed and removable prostheses. Using this knowledge, the dentist must be able to discuss the relative advantages and disadvantages of alternative treatment options. Dentists should also be aware of the general techniques employed in the construction of fixed and removable conventional dental prostheses, including clinical and laboratory stages. A dentist entering implant training should know how to make adequate impressions for study casts and working laboratory prosthodontic casts. They should be able to make an accurate record of the interocclusal relationship that is of sufficient quality for the construction of dental prostheses. The dentist should be able to provide aesthetically pleasing and functional conventional fixed and removable prostheses for patients. This includes selecting the correct tooth shade for a dental prosthesis that will match the natural dentition. Dentists should furthermore be trained to evaluate existing fixed and removable dental prostheses and to offer patients advice and treatment in order to help them maintain their prosthesis in an optimal condition in both the short and long term. Dentists should have a good level of knowledge of endodontics. This includes knowledge of etiology and diagnostic criteria for pulpal and periapical disease. It also includes knowledge of prognostic factors for endodontic therapy, as well as survival and complication rates for endodontically treated teeth. In addition, the dentist should be up to date with current evidence-based treatment approaches in endodontic therapy. The dentist should have the ability to diagnose teeth in which stepwise excavation of caries can lead to endodontic prevention, and should also be able to employ recommended techniques when endodontic therapy is required. Dentists should have general knowledge of orthodontics and be able to detect malocclusions and deviations in development of the dentition and facial growth. The dentist should have the ability to evaluate the need for orthodontic treatment and to determine the need for referral to a specialist if appropriate. The dentist should also possess knowledge of simple and complex treatment options for all age groups, and recognize indications for orthodontic input as part of multidisciplinary assessment and planning. General dentistry knowledge and skills. Key learning points. A dentist intending to undertake training in implant therapy should have good working knowledge and skills in the following areas: patient communication, assessment, diagnosis, and treatment planning. Diagnostic radiology, including the ability to take and interpret intraoral and extraoral radiographs. Local anesthesia, surgical flap design, routine use of surgical instruments, wound closure, and post-operative healing for minor oral surgery. Periodontal disease and its etiology, diagnosis, and management. Prosthodontics, including conventional prostheses as treatment options for the replacement of missing teeth and tissues. Short and long-term monitoring of the patient's prostheses and periodontal status. Endodontics, including the prognosis for endodontically treated teeth. And orthodontics, and its role in a multidisciplinary treatment planning approach. The safe and effective practice of dentistry requires that certain standards and protocols be implemented and kept up to date. Core areas include medico-legal issues, biosafety, management of medical emergencies, and radiation protection. Implementation and updating in these areas can be accomplished with regular continuing professional development and continuing medical education courses. All dentists must be familiar with medico-legal issues in relation to dental treatment. It's vital to know the principles and processes involved in obtaining informed consent from patients prior to dental treatment. Accurate documentation and recording of all clinical activity are essential skills, including the use of auditing to confirm and improve clinical standards. The dentist should also be aware of the professional regulations governing the practice of dentistry and implant dentistry within the country or territory in which they practice. To prevent unintentional exposure to biological agents, the dentist must have sufficient training in the area of biosafety. They should know how to implement protective measures during dental procedures to control the spread of microbial infections. They should know the components of an aseptic surgical protocol to prevent contamination of wounds and susceptible sites. Dentists should also be aware of the regulations and guidelines that apply to the disposal of biomedical waste in the area in which they practice. The dentist and team should have regularly updated training on the handling of medical emergencies that may occur in the dental practice. This should include the use of simulated emergency scenarios. The dentist should feel competent to carry out the initial management of medical emergencies that may be encountered in a dental practice context, such as cardiopulmonary resuscitation. For the protection of the clinician, employees, and patients, the dentist should complete core radiation protection training. This should be updated regularly to maintain a knowledge base which is informed by current evidence and best practices. The frequency of the required updates will vary depending upon the requirements of the regulatory bodies and radiation protection organizations of the region in which the dentist practices. Dentists should be familiar with the radiation protection issues related to the use of common intraoral and extraoral radiographs. They should also be broadly familiar with the issues related to the use of computed tomography scans, although it is recognized that this knowledge may not be in depth at the start of dental implant training. Practice standards, key learning points. Practice standards in a number of core areas need to be kept up to date when providing implant dentistry. Dentists should be familiar with medico-legal issues related to dental treatment, including communication, informed consent, clinical record keeping, and auditing. Key knowledge in the areas of biosafety, management of medical emergencies, and radiation protection should be regularly updated via continuing education. It's important that any dentist entering training to place dental implants be able to demonstrate knowledge in the relevant subject areas of oral biology and medicine, including anatomy, pathophysiology, medicine relevant to dentistry, pharmacology, and oral medicine. Dentists should have a good working knowledge of the anatomy of the head and neck region. Specifically, this should include the surgical anatomy of the maxilla, the mandible, and the surrounding tissues. This knowledge should cover an awareness of all common anatomical variants. The dentist should also have a knowledge of the boundaries and pathways of major anatomical structures within the maxilla, mandible, and surrounding tissues.